I worked at a big hospital right in Koreatown. So naturally, we had a really large Korean population. And I didn't really know the culture. What they teach us in school is that you need to educate yourself around different cultures. You need to have an understanding to be able to develop a relationship and rapport. And so it's kind of the same thing in the clinic, right? We want our students to be able to have the best relationship with this clientele.
Welcome to the APTA Orthopaedic Podcasts, where we help you stay ahead in orthopedic physical therapy. I'm your host, Luciano Garcia, and today I'll be talking with Dr. Melissa Hoffman about clinical tips for an orthopedic therapist on treating the LGBTQIA plus population. Don't forget to subscribe for future episodes. Let's get started. Welcome, Mel. Can you tell us a little bit about yourself, please?
Hey, Luciano, thank you so much for having me today. It's such a treat to be able to talk to folks, especially in the orthopedic section, about some of these issues that are specific to sexual and gender diverse populations. Hi, everybody. My name is Mel Hoffman. I'm excited to be here today to chat with you. We'll move through a bunch of different types of questions, I'm sure, and hopefully they will be very informative to your practice. Just a little bit about me. I currently work at Regis University. I'm an associate professor in Denver, Colorado. I've been with Regis since 2017, full time. And I currently at Regis, I have a PhD in research methods and statistics. So naturally, I teach in the evidence-based practice series. But I also have over 25 years experience in the clinic. I did not work in orthopedic physical therapy. I worked in acute care, neurological and trauma intensive care. But I did have my fair share of orthopedic cases and multiple orthopedic, like multi-trauma type cases. So I think I can still be very informative to all of you, even though I didn't specialize in orthopedic physical therapy. But I'm excited to be here, and I'm excited to share the information that I'm going to share today that is specific to sexual and gender diverse populations. My research over the last 8 to 10 years has really centered on sexual and gender diverse populations, and particularly health and healthcare access. So I'm really excited to be able to talk with you about this information today, and hopefully be able to share some really valuable information and even some information about the studies that I have done. So thank you for having me.
Great, Mel. Let's start from a baseline here. Can you go over the meaning of the initials, please?
Yeah, and do you know that it's so funny that you asked me this question, because that acronym is constantly changing and there's always more letters that are being added. So currently we have LGBTQIA 2S plus. So let me share what each of those are. So the L stands for lesbian, the G stands for gay, B stands for bisexual, Q stands for queer, T stands for transgender. The I stands for intersex. So intersex are those individuals that are born with both male and female sexual organs. Then we have individuals that are asexual. And then finally, we have this 2S. And so 2S stands for two spirit. And so this two spirit term, it is used by some indigenous people to describe individuals who embody both a masculine and a feminine spirit. So it's really important that we include this as a unique part of the acronym. And then the plus, of course, stands for other and beyond identities. You know, we have individuals that identify as non-binary or genderqueer, or, you know, there's a lot of other different acronyms that people are using today. But this is the most updated version
Very nice.
of this acronym.
Mm-hmm. Can you talk about the importance of cultural competency with this population?
Of course. And this is something that's really important and valuable to me to speak about because it's the center and the focus of my current research agenda. So,
Mhm.
cultural competence is really crucial with this community to provide effective, respectful, and affirming care. Um, Oftentimes, you'll see in physical therapy and even in other healthcare settings, there's a lack of this cultural awareness, and
Mhm.
this lack of cultural awareness really contributes to the current health disparities that we see, this mistrust, right? So, this lack of
Mhm.
therapeutic alliance or therapeutic rapport between patients and physical therapists. And at the end of the day, poor health outcomes. So, what are the reasons, the key reasons why cultural competence matters? Well, first and foremost, like I talked about, we want to reduce health disparities and barriers to care, right? So we know from the research that individuals, particularly individuals that are within this sexual and gender diverse community, they face higher rates of healthcare discrimination, which will lead to decreased access. Why? Because these individuals are avoiding access of medical services, right? So, some examples, right? Maybe somebody has chronic pain and this pain is not going to be treated because they fear discrimination from their providers or institution. Maybe they will, because of this discrimination or even a microaggression that happens, maybe they'll avoid rehab after an important surgery or an injury. And then also limited access to gender affirming physical therapy, right? So there's not a lot of individuals that have this skill set to treat this community, and in some cases they don't even have the desire to treat this community. So it's really important that we educate clinicians about these health disparities for this specific community, including the best practices that we can use as providers to build trust, right? And to
Mhm.
increase encouraging them to access care. The other thing, another really big piece is enhancing the enhancement of patient and provider communication. So this we see a lot,
Mhm.
right? With our communities, they
Mhm.
have negative experiences from healthcare professionals, and this is going to result in them not wanting to go back to see a physical therapy provider. So,
Mhm.
what kind of things are included in the communication? Well, we have using correct names and pronouns. That's
Mhm.
going to improve trust, right? If a lot of
Exactly.
I do know a lot of the places that are trying to be more affirming, and I know even in the acute care hospital setting, they actually have like the therapist pronouns on their name tags, which is welcoming,
Oh, nice.
right? So it
Mhm.
allows that person to potentially know this is a safe space and they have an understanding of some of the language
Mhm.
that is involved within my communities. So, that brings me into understanding gender affirming language, right? So
Mhm.
that's going to create a more welcoming and safe space for these individuals to receive care. Um, and then avoiding assumptions. This is a big piece, right? So
Mhm.
I know, Luciano, we have talked about this before about
Mhm.
implicit and explicit bias.
Mhm.
And I know that, there's a lot of therapists that don't necessarily know these terms and they don't even know that they hold these biases. So, for example, we did a study with clinicians, we did a qualitative study with clinicians, and we were specifically looking at cultural competence around LGBTQ care.
Mhm.
And a lot of the clinicians, they would kind of have these implicit biases come out in their discussions or in their interactions with their patients, but they didn't even know that they were doing it. So they didn't know what they didn't know, right? And so
Can you give examples on those?
yeah, it's like, and then the thing is that okay? Well, I don't know.
Mhm.
Is that okay? An explicit bias is pretty direct, right? An explicit bias,
Mhm.
comes from somebody's, political background, perhaps, or maybe their religious and moral backgrounds. These are things
Mhm.
that people have learned from the environment that they live in, right? those are pretty explicit. Those explicit biases are pretty noticeable,
Hmm.
right? But the implicit bias, that's the ones that people don't realize, right? And maybe they'll have a little microaggression, right? Maybe they speak and they say something that they learned from when they grew up that is offensive to somebody. Like, we don't really say the word homosexual anymore, right?
Hmm.
We use sexual and gender diverse people. And so, if somebody went into a clinic and somebody used that kind of language, that could be potentially offensive, right? And
Hmm.
those are called microaggressions. The other thing is I think that a lot of folks, a lot of clinicians, they haven't really self-reflected on what their own biases may be, or
Hmm.
what implicit biases may they have, that they don't even realize that they have. And so I think it's really important, as related to cultural competence, that clinicians really first do this self-reflection piece of themselves and say, like, what biases do I potentially hold already and how can I counter those? We're not asking people to change
Hmm.
their moral values or their religious beliefs or things like that, but it's important to keep them in check, especially when you're treating a community like this where it could be potentially offensive. Um, the other thing is providing inclusive and affirming care. Like, that's
Hmm.
part of cultural competence, right? We want
Hmm.
our patients to feel safe. We want them to feel respected. We want them to better adhere to their treatment plan. We want to see the most optimal treatment outcomes that we can see from our patients, right? And so it's really important for us as clinicians to recognize the unique needs that come with treating this patient population. So things like, post-operative care for gender affirming surgeries, like vaginoplasty is pretty popular here in the States.
Hmm.
Phalloplasty, there's a lot more complications with phalloplasty. So, vaginoplasty procedures are for transgender individuals that are transitioning from male to female. And
Okay.
then phalloplasty, which we don't see very often because of the complications, that is for an individual that is transitioning from female to male.
Hmm.
So it's important if you're going to offer treatment in your clinic for this patient population, you might want to um, go to the evidence and learn more about these specific types of procedures and hormone therapies, things that are going to come along with this patient population that you really need to consider. It's not as, when I think about orthopedic physical therapy, I always think about, it's pretty straightforward, right? Like,
Hmm.
not all cases, but
Correct.
if you break a bone, it's pretty straightforward. There's some
Hmm.
other more complicated things, I'm sure.
Hmm.
But with these individuals, when we're looking at things like hormones, and hormone therapy, that's changing the composition of their body and the physiology of their body. And so it's really important that we understand those specific health concerns of those individuals that are receiving that care. And then the
Hmm.
other thing about affirmative inclusive care is having a welcoming clinic, right? So inclusive
Hmm.
intake forms, having a gender neutral restroom, these are the first
For
things,
sure.
right? These are the first things that an individual is going to see when they walk into a clinic, right? And so if they don't feel like it's a safe space just walking into the waiting room, a lot of them are just going to get up and walk out, right? That's just the way it goes. The thing that we learned during some of our focus groups from the patients, so we did 3 studies on cultural competence,
Mm.
qualitative work. One was interviewing clinicians and how they felt about their own cultural competence. The
Mhm.
other was with patients, and they got to tell us how they felt the clinic or the providers were culturally competent. And then we also did another study with faculty and students. But when we talked to the patients in that study, there was a really interesting comment that happened when we were talking about inclusive spaces. And one of the participants had said, well, I went into the waiting room and it was great, right? It was welcoming. There was a gender neutral bathroom. The paperwork had options for gender and sexual identities,
Nice.
which was really it was a very positive experience for that
Mhm.
individual when they first walked in and they were encountering and accessing this type of care. However, when they went into the clinic to receive that care, they found that the provider was not educated and that they were having to educate the provider, and that the provider didn't know the appropriate questions to ask. And so that's frustrating, right?
Mhm.
That's not going to make um, that's not going to make an individual want to go back to that clinic. So there really needs to be a healthy balance,
Mhm.
um, a healthy balance there. Yes, I think it's important to create a space on the outside that is welcoming and safe, but it's also important that you go the whole distance. If you're going to do it, don't half-ass it, right? You
For
gotta
sure.
go you gotta go the whole way, right? You
Uh,
gotta if you're gonna spend the time and the money to make your office more inclusive, and sometimes even just having a pride flag like you see behind me,
oh
it
yeah.
it lets people know that this is a welcoming space. And there's oftentimes like these little stickers that individuals can put on their windows to let an individual know that that's a safe space.
Mhm.
But these are kind of the important things. The other thing that I wanted to talk about was mental health and trauma informed care. So a lot of
Mm.
these individuals, they have experienced some level of minority stress, discrimination, trauma, and that's not just necessarily in the physical therapy realm, but this is
Mhm.
across healthcare, right? So all of these individuals have experienced some level of discrimination, right? Probably more so our non-binary and transgender communities.
Mhm.
But even individuals that are lesbian, gay, or bisexual, right, have experienced some level of discrimination. And the thing is it's there are individuals because of that trauma in this community that maybe have a higher sensitivity to touch. They might feel vulnerable, and
For
we
sure.
actually we actually did have a client that was in a clinic, not necessarily. I don't believe it was a gender affirming clinic. I believe it was just one of your, run of the mill orthopedic clinics that they had gone to, but they identified as, I want to say that this individual was transgender, and they were passing for the gender that they transitioned to. So in this case, most likely they were female to male,
Mhm.
right? And so now we have this individual that identifies as male, is passing as male, and is going in for a routine knee injury or something like that.
Mhm.
But because this was a run of the mill clinic and it wasn't specifically a gender affirming clinic, this patient expressed this vulnerability, right, in their treatment, and this discomfort with touch. And probably because they had already had some level of trauma, maybe before or during their transition, that they had experienced. And so in this clinic, they didn't feel safe to
Mhm.
um, to really confront their therapist with who they were and how they identified. And that's a disservice, right?
Mhm.
When we talk about, I don't know, I'm doing a lot of talking. I'm really passionate about this area of practice.
I love it. Mhm.
So I don't know. I just think that it's really important that in order to establish this therapeutic rapport or have this therapeutic alliance,
Mhm.
to have this trust, you got to be able to understand the community. You need to understand the background. You need to understand and be educated around the disparity, perhaps some of the trauma and discrimination and the stress that they have already gone through. I think that in itself helps to kind of build that trust and that positive relationship, which is going to really address that problem or that issue of access. So
Mhm.
yeah, so I just think it's really those are some of the key things that when I think about cultural competence, these are the things that we've studied and that we've talked about and that are very important. The other thing is when we talk about language in the clinic, it's important to understand how somebody might interpret a part of their body, because that could be very different than like what you call the chest. Maybe they don't call the chest. If somebody has had a gender affirming surgery, maybe they had a top surgery, right? Maybe they were transitioning female to male and had a top surgery. They might not like the language of chest, right? So, then a lot of orthopedic therapists or any therapists that are not knowledgeable will say, well, then what do I say?
Mhm.
What do I refer to that body part as? It's the chest. And I'm like, I get it. But you can put the onus back on the patient, right? You can ask them what they refer to that body part as. So that's just
Great
something,
idea. Mhm.
right? That's just something that you can do in your clinic. It's so easy, right?
Mhm.
To do that. Some of these things that we're talking about today, they're easy things to be able to slip into your practice. Hey, my name's Mel. I'm your physical therapist. I go by she, her pronouns. Done.
Mhm.
Did that take a lot of effort? No.
Mhm.
It's like another 3 seconds to your introduction. But that 3 seconds is a really big deal to this clientele. So, you know, I just I'm pretty passionate about cultural competence. These are some of the main issues that I think come up,
Mhm.
and they have come up in the studies that we've done. And so the
Mhm.
evidence is really pointing to some of these issues as things to consider.
For those of the clinicians who are clinical instructors, what can they teach or convey to their students about treating this population effectively and respectfully?
Yeah, this is a really great question. And I'm really glad that you're actually asking this question because, our students are our future, right? And so, with the climate today, it's the national climate right now, there's a lot of uncertainty, right? Because they're abolishing DEI programs. And for those of you that might not know that acronym, that's diversity, equity, and inclusion. Um, and they're abolishing these practices in multiple universities across the country, and so folks are not able to teach this content, which is really critical, right, to the development of our therapists that are going to be entry level therapists. We teach about race, we teach about ethnicity, we teach about people that have different religious backgrounds, right? And so it's really important that we may continue to teach and to educate our entry level therapists on this content as well, because whether we know it or not, it can and it will impact their care, right? And I mean, what do you do, Luciano? We go
Mhm.
into a if we go into a room. I worked in LA, right, for a number of years, and I worked at a big hospital right in Koreatown. So naturally we had a really large Korean population, and I didn't really know the culture. What did I add? I What they teach us in school is that you need to educate yourself around different cultures, right?
Mhm.
And you need to have an understanding to be able to develop a relationship and rapport. And so
Mhm.
it's kind of the same thing in the
Same
clinic,
thing.
right? We want our students to be able to have the best relationship with this clientele. And so, things like using inclusive language, right? As a CI, I hope I hope that the place that you're in is advocating for that as well, right? I know at University of Colorado Health, we have an actual tab in Epic within the medical records system where we can
Mhm.
hit history and we can look at sexual and gender identity. And we also have preferred pronouns or preferred name options. So it kind of starts there. But I think for a CI, I think you should have an understanding and have some education around the importance of using inclusive language. So that's things like pronouns or correct anatomical terminology or how to approach that with a patient, asking
Mhm.
for consent before you touch somebody, because I mean, this is like common knowledge, right? When we go into a room or we have a patient come into the clinic, we shouldn't just be touching that patient wherever we want. We should be asking
Mhm.
for consent. We don't know where that patient came from. We don't know what their past experiences may be. We don't know what trauma they have experienced. And so naturally, we as physical therapists under the whole umbrella of practice should be doing that, but it's not happening. But I think it's important that we use correct terminology. We ask consent before touching. We should challenge this heteronormative or this cis normative assumption, right? And that there's
Mhm.
only two genders, which right now, our current leader of the United States has told us that there's only two genders. There's only male and female. We know that that's not true, right?
Mhm.
I don't know. I feel
Mhm.
like I want to encourage our future clinicians, our future therapists to, treat people as they would like to be treated and treat people under the identity that which they would like to be known. So, I think it's important for, individuals to have this education before they go out into the clinic so they understand this umbrella of identities that they may encounter. I think it's important to, provide a safe space, and that's free of judgment or bias. So a CI, hopefully they're representing that to their student, but also, ensuring that the student um, not see some negative biases from other disciplines that they might come in contact, especially in like a hospital setting. But a lot of these orthopedic clinics now, I mean, there are orthopedic settings that are within a hospital as well.
Mhm.
But a lot of these orthopedic settings have multiple practitioners from different disciplines that are also in the same environment, right? So
Mhm.
it's really important that we as clinical instructors set a good example for our students, and staying informed and continuing education. So, I have a PhD in research and stats. I love evidence based practice. The best thing that we can do as CIs is encourage our students to continue to go to the evidence to
Mhm.
support their practice. See what kind of changes are there. Look at the studies that we've done, on LGBTQ plus communities. Really learn, get an understanding of what this treatment might look like, especially if your institution is not able to or is not going to provide that education.
Next question, Mel. As a well published APTA author on this topic, have you run into funding issues or recent changes?
Yeah, I mean, right now the NIH is completely closed, right? We used to have a whole section of the NIH that was dedicated to gender and sexual minority research. If you go to open up that page now, it's gone.
It's
Like,
gone.
you're not even going to see it. Yeah, you can't even access it. Although, I did, and I know that any new studies that had not been published yet are not going to be posted through NIH websites. The good thing is that the research that we have published in the last year or two is still coming up. I was just on online the other day, and I just for kicks went in to see if my research would come up through the NIH, and it
Mhm.
did.
Good.
So I think prior research is still coming up, but if you're interested in getting grants, honestly, and I'm not going to say too much about the new administration that's in. I think most people know my feelings
Mhm.
about the new administration that's in, but really, it's going to be super challenging to get any national or federal funding for this type of research specific to gender and sexual identities in the next 4 years. So your best bet is going to be funding that you can get internally, right, through your institution. I know Regis, we have the University Research and Scholarship Committee, and they give up to $5,000
All right.
for internally funded research studies, and we get about a budget of about 50,000 at Regis to dedicate to grant funding, which is really amazing
Mhm.
for a smaller institution to provide that. Your other avenue, and there's probably multiple different. I know we have our University Research and Scholarship Committee, but we also have our school, our college
Mhm.
research and scholarship committee, which also provides a Dean's Excellence grant for research. So these are just some opportunities that you can look for internally in your institutions. Externally, I think the best bet for this type of research, if this is what you're interested in doing, it's going to be through foundation funding
Mhm.
and foundations that are very specific to your cause.
Mhm.
And there's a lot of them out there. You just need to kind of probably do a little more work. It's going to be probably a little more competitive because now we don't have that federal side of things. But, I want to say one thing, Luciano. I know we're getting close to the time, but the thing about the importance and the value of this federal funding and these studies that are no longer getting funding, they've been stripped of their funding. This is a huge disservice, right,
Mhm.
to our practice and to this specific community, because the data, the quantitative data that individuals were getting through like randomized control trials, things, higher evidence studies,
Mhm.
is really important to our outcomes, right? And how we see our outcomes for these communities, because a lot of these communities, a lot of individuals within this community, they come from a number of different identities. So intersectionality is so important. We're not just gay, we're not just lesbian, we're not just transgender. We might be Black and gay, right? We might
Mhm.
be white and transgender, that we might have different ethnicities, right? Somebody might be Jewish or Muslim. So it's really important um, that we get this data, because it's really important to the future um, of health in itself, so that
Mhm.
we can look at the data trends and see what is the best way to treat these individuals.
Any recommendation on resources, websites, or other podcasts or journals that orthopedic clinicians can use to improve their treatment approaches with this
Abs-
population?
Absolutely. We have so many resources. I was the chair of the PT Proud SIG, which
Mhm.
was under the Academy of Leadership and Innovation, which used to be Health Policy and
Mhm.
Administration. They're now the Academy of Leadership and Innovation, or ALI, within the APTA. So the PT Proud SIG has a lot of really great resources. If you go to the ALI website, you can actually access the SIG site. It's a new site. PT Proud just kind of transferred over when they became a SIG to the ALI website. So I think we're continuing to upload new resources, but it's a great place to go to ask questions, to access resources. They do have a competency handbook. It's called the Introduction to LGBTQ plus Competency Handbook for Physical
Nice.
Therapy. If you can't find it um, on the website right now for the PT Proud SIG, the UNC website actually has it. Like if you just Google Introduction to LGBTQ plus Competency Handbook for Physical Therapy, you should be able to find a link to download it, the direct PDF. Um, and again, I talked about our website, um, the APTA ALI website slash
Mhm.
PT Proud. There are NPCEC resources for inclusion, the National Physical Therapy Continuing Education Consortium. They provide a huge collection of resources, including the handbook that I just talked about. So
Mhm.
that's also a good place to access it. Other resources are GLMA, so the Health Professionals Advancing LGBTQ plus Equity. So you can go to the GLMA website. Therapy Den, that's a really great place to go to for users to find a specific LGBTQIA plus affirming therapist
Mhm.
in their area. The Trans Lifeline Therapist Database also provides specifically trans affirming therapists. What are some other good ones? The Trevor Project Care Training website is a really great place to go for free online courses and webinars.
Mhm.
So that's a really great place. The National LGBTQIA plus Health Education Center. Again, there's free online courses there and webinars. I do want to say also the Trevor Project um, has training for crisis intervention and mental health support for this
Great.
community as well. And then, I'm just going to name a few papers, but
Okay.
it's the three of the papers that are out. Of course, our two papers, you'll find it. Hoffman, if you put my name into Google, it'll be really easy to find. We had our LGBTQ plus cultural competence in physical therapy, an exploratory qualitative study from the clinician perspective. The next paper was another qualitative study from the patient perspective. And then there's another author, Megan Ross, out of Australia and New Zealand. She does a lot of research in this area as well. She has a paper, Physiotherapy Students Hold Varying Attitudes, Beliefs, and Learning Preferences Regarding LGBTQ plus Healthcare. That was a mixed method study. All of these studies were published in PTJ, so Physical Therapy Journal.
Great.
So Physical Therapy Journal is still publishing these
Yeah.
papers, which is really great. I don't know how much federal funding they actually receive, but they're still currently publishing this type of work. So it's a great place to go to
That is
find some
great.
resources.
Hmm.
A lot to be said, right?
Yes, that's a lot of great information.
I hope so.
I learned a lot. I learned a lot today.
I hope that individuals can take this back to their clinics
Hmm.
and hopefully implement some of the things that we talked about today, and also, access the resources that we talked about, um, and really know who you are, right? Explore yourself so that you can understand others a little better. Really, thank you so much for giving me this platform and opportunity to talk with you all today.
I want to thank you, Mel. This has been so informative. I've learned a lot. I know the listeners are going to learn a lot from this. I just want to say final thank you, Mel. And thank you all for tuning in to APTA Orthopedic Podcasts. We hope you found today's episode informative. Remember to subscribe. And until next time, stay ahead in orthopedic physical therapy.
Thanks, everyone.